So good evening, good afternoon, morning, wherever you are from. Welcome to Edu Skills, OET made easy. Our mission is to make you fall in love with OET. If you are watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. Today we'll be dealing mainly with the reading subtest. I will start with the reading part C. One or two questions we'll deal with. After that, admins have requested me to take up one part A. We may not do since we have done nearly 24 part A segments, uploaded videos are there. So I'll not be doing in detail. However, we will take all the steps, maybe 12 steps to work out how it is to be handled. And at the end, we'll have your concerns answered, especially like resources regarding ebook and what you call the materials and other things. And also some of the concerns are being posted now in the YouTube comment space. I'll be going back to them at the end of this session. All will be invited to Zoom classroom at the end for the clarifications. You can come here. We will post the Zoom link in the YouTube comment space. As of now, it's for those who have requested the Zoom link. We have admitted them into the Zoom classroom. Okay, let me share my screen, and if you can see, keep sending some smileys. Okay. And let me know if you can see my screen. And please like if you have not liked so that we reach to maximum people. Click the like button. Yes. Just let me know in the YouTube comment space if you can see my screen and if I'm audible and visible. Type in 2 yes, one for visibility of the screen, one for my audibility, and third one for my visibility. Yes. 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 Yes.
Yes, it's
Yes, for the visible. Yes. So if there are beginners, just type in B in the YouTube comment space. If there are beginners in the session, so that I know how should I go about, just type in B, letter B. If you're a beginner, just type in letter B. Only beginners, just type in letter B fast so that I can customize. Type in. If there are beginners, type in letter B. Just B, beginner, or type in beginner at YouTube comment space. Yeah, one is there. See there, yes. Two, only two, right?
in
Beginners.
Zoom, we have one person, Father.
Yeah, already she has mentioned there in the YouTube comment space. Yes, only three, I believe. Any other beginners in the YouTube comment space? Just type in B so that I know how many are there, so that I can just customize my teaching so that you can understand better. Only three. If you have not liked, just click the like button so that we'll go. Yeah, you'll have to give me energy because my backbone is a bit hurt. So unless you give me some energy, I will be slowing down. So reading part C, key skills. Okay, many of the concerns which happen to be in the comment space and which you send me personally are because they are not able to, you haven't watched the episodes. See, watch the episodes from 1. Now we have posted 30 episodes. All of you have to watch them because you have answers for all the questions. These episodes are constructed in such a way, all the concerns are answered there. Okay. So we can't repeat an answer to each one. It's impossible, humanly impossible to answer thousands of people. So please watch those videos. After that, whatever is extra, we will answer. Today will be at the end of this session, we will be dealing with those concerns and also about the free resources, ebook, and those details and links will be given to you. Sample one is from sample one. This text one is from sample one, synthetic voice. This one I'll not be dealing with in detail, but the second question I'll be dealing in detail. Okay, so let me minimize the screen. Oh, lost it. Okay, now this is question number 9. This is from official sample. Thank you, OET, for allowing me to use this for teaching purpose. In the third paragraph, we learned that Red Malling developed the POSM due to. Just tell me what are the hedging words here. You can type in the
Name
YouTube comment space. Yeah, name.
Red Malling name.
Yeah.
Due to.
Since there are only
Due to.
Since there are only three beginners, don't worry if you don't understand something, but I'll try to explain it as you understand, but then we'll not be going to all the details. For example, if there is a name, okay, there's also one more name, right? Abbreviation.
Yeah.
Abbreviation is, sorry. So beginners will have to underline these things as well in the third paragraph, which means as soon as you get the material, you have to number the paragraphs in both the texts in part C. You have to number paragraphs 1, 2, 3, 4, 5, 6, 7. So if there is a name, nothing else you need to see. Okay. So immediately, just we'll read the options. The number of people who had permanently lost their voice. What are the keyword or phrase?
Permanently lost.
Permanently lost.
Voice.
Okay.
Voice.
Then second one, the lack
Number
of
of
accessibility in
people.
previous
Lack
SIP
of
and POSM
accessibility.
designs.
Lack of accessibility.
Accessibility.
Okay. And option C, please mute.
Limited-
Okay, if you have background,
Limited communication.
the
Limited
limited
communication.
communication options for limited communication options.
Disabled.
And if you have background distractions, don't unmute. Okay. Yes, the recent development of similar sound technology.
Recent
development.
Recent development. Sound technology.
Recent development.
Yes. Recent development. Okay. How sound technology? These underline the keywords or hedging words are just for your understanding. You can understand more or less. Sometimes you need to understand, or maybe if you are competent, you need to highlight only one word. Sometimes you need a phrase. Sometimes you'll have to have the whole sentence. It's cool. Okay. But then we have just read the options. Now, what is the principle? If you have a name in the question stem,
Immediately go to
the name. So skim for the name now. Where is the name? Red Malling.
fifth line.
Fifth line. Okay, Red Malling. Okay. And you have one more name. You can find both. That is POSM.
POSM.
Above line.
Fourth line.
Now, do you find any answer somewhere around there?
Yeah.
This was developed by, Red Malling developed by, right? They're asking the next clue, if you want, is next hedging word is due to. Due to means
Reason.
reason. Okay, it's asking for a reason. Why did Red Malling develop this particular POSM, patient-oriented selector mechanism? So POSM was developed by Red Malling. Why? You have to read further. Then you have a comma and something, a volunteer at a hospital of paralyzed people. After he
Subject complement.
Subject complement.
Complement.
Subject complements. You can just eliminate, ignore, because that's not essential. Okay. After he discovered, why did he develop this one? The reason is after he discovered that patients at the hospital who had lost the use of their voice were only able to communicate using a bell.
C.
Do you have, what does it mean? Do you have any similar option? He developed it because he discovered that patients at the hospital who had lost the use of their voice were only able to communicate using the bell. There are no other communication means.
Limited communication.
Limited communication.
Limited communication option for disabled people.
Using a bell.
So this is how you manage the time. You need not read anything else. If there is a name in the question stem, understand that I underline question stem. Sometimes people say there was a name in the option. Then I went in search of that name. You cannot. Okay, how do you now? People very often ask me, how do we identify what type of question it is? Now, this is known as name-based question. Name-based question. How do you identify? Understand? If there is a name in the question stem, that is a name stem, name-based question. And there you can, within fraction of seconds, you can identify the answer. You need not read even 90% of the paragraph. Is that clear? Here you see limited communication. Only able to communicate. Using a bell means limited communication, right?
Yes,
That's a synonymous expression, the limited communication options. And what else is there? He discovered that patients at the hospital who lost the use of their voice, what is the synonym used?
Disabled people.
Disabled people.
Yeah, disabled people. Disabled people. Okay. So you need not read until the name appears. And immediately you have the name. Then do you need to read the rest? So, see, though they have given such a long paragraph, the strategy tells you just read this sentence. Answer is there. But don't worry, beginners, if you don't understand, that's because of the low competency of language. Gradually, when you practice, you will understand what is synonymous expression and all those things. This is exactly the C option. Option C is the exact paraphrasing of what we have highlighted here, this portion. Okay, this is the answer. That's the paraphrasing.
Father, I have one doubt, Father.
Yeah, please.
Your last sentence, only able to communicate using a bell. So, is it not sound technology?
Sound
D
technology.
option.
The recent development of similar sound technology. They are asking, why did he develop it? Why did he develop a new thing, a machine, mechanism, POSM? That is speaking about another development, right? Recent development of similar sound technology. He developed because there was a similar technology. If there is a similar technology, why should he develop one? Right?
Okay, Father. Understood.
Okay. So due to the limited communication option for disabled people, can you say, you have to always practice reading this way. In the third paragraph, we learned that Ed Malling developed the POSM due to the number of people who had permanently lost their voice. Again, in the third paragraph, we learned that Ed Malling developed the POSM due to option B, the lack of accessibility in previous SIP and stuff, puff designs. Then third option also, you have to read with question option. In the third paragraph, we learn that Malling developed the POSM due to the limited communication options for disabled people. And for option D, again, read with the question stem. In the third paragraph, we learn that Malling developed the POSM due to the recent development of similar sound technology. Does the paragraph speak anything about recent sound technology and its connection with Regmaling? Why? Simply it says, why did he develop POSM? Why did Regmaling develop POSM? POSM, that is patient-oriented selector mechanism. Here you can even ignore this because it's not required that you should know the full form. This or whatever between the commas also can be just ignored. Then what happens? You read, POSM was developed by Regmaling after he discovered that patients at the hospital who had lost the use of their voice were only able to communicate using a bell. That was the only possibility of communicating. Just click the bell, ring the bell. So he wanted another mechanism where they can easily communicate and have more communication options. There are so many other strategies. I am not touching it now. Okay. I am drawing your attention to something else. We'll go to the next question and understand. These are from official OET website materials. Okay. Is that clear?
Okay, Father.
Yes, Father.
Okay. Again,
Yes, sir.
see here this is speaking, first portion, the middle portion is speaking about POSM, but below it is speaking about AACs. They means AACs, another machine, communication device. These devices means AACs. So this portion, lower portion is speaking about a different machine. They are not asking about a different machine. They are asking about POSM. That is patient-oriented selector mechanism. This is speaking about
Yes.
AACS.
AACS means adaptive alternative communication devices. Okay. So let's go to the next one. Here, only able to see these are things. Even topic sentence and all important, but we are not looking into it now. Just let us see, just see the highlighted version. One instrument, there is some distraction at the background, beware of it. Okay. I'll just show you highlights. I think it is Indrajit. You are doing some other business now, please don't do it and being in the Zoom classroom. Give me 2 seconds, my system is not responding. Discussion link will post. There is some sharing issue. Give me 2 seconds. There is some technical hiccups. My screen is stuck. Is my screen visible at YouTube?
large.
In the meantime, you can type in if you have some concerns. I'm just setting right my technical issue. Somebody is asking, is it cause and effect? Now, this question is not cause and effect. This is reason, solution. A problem and reasons are given. Problem is presented, then reasons are given. Somebody is asking, is this a cause and effect question? No. Problem, reason 1, reason 2, reason 3. Problem, solution 1, solution 2, solution 3. Here there were problems, so they have found out solutions. If you have any doubts, you can ask in, okay, because my system is responding very slow. I'm setting it right.
Father, your due to means cause. They're asking for a cause. We have to find out a cause, isn't it?
Yeah, but then what the question was that whether it is a cause and effect language type of text. This is not cause and effect. This is reason, a problem, solution. The nature of the text is not cause and effect. Correct?
Yes, yes, sir. Correct.
Okay. You can able to see your screen is problem, solution is correct. Confused with option 1 as well. The number of people who had permanently lost their voice. Does the text mention anything about permanent loss of voice? It's mentioning those who have lost their voice. Permanently or temporarily is not mentioned in the text. Do they mention anywhere? So I'm not able to enhance my screen. So we'll just show you here itself. I think there is some network issue. Do you have anywhere? See after we discovered that patients at this hospital who had lost the use of their voice were only able to communicate. Do they say permanently lost their voice?
No.
No, Father, no.
Yeah, that is.
They're talking about communication
Yes.
only.
Yeah. So you see, I have just highlighted. I am not able to show it systematically because of the technical issue. See, the abbreviation is there. If you remember, when you skim, you have to look for names, abbreviations, scale, then all those things like sequential expressions and all those. Therefore, the why not permanent instead of limited? Because both are not mentioned in the statement. Why permanent? Why not permanent instead of limited? Limited, only able to communicate means limited communication, right? Someone is asking me, why not permanent instead of limited? Because both are not mentioned in the statement. Someone is messaging me saying that, now you say it is now permanently is not mentioned. But then why do you take the C option where limited? Limited is not mentioned in the text. Others give me an opinion, is limited. I have already put an arrow there. Only means?
Only means
able
limited.
To limited. Only able to communicate means limited. That's why it's synonymous expressions. Maybe you are a beginner, don't worry. As you go on watching, you'll understand that. Permanent is not at all mentioned. Limited is mentioned. A synonymous is mentioned. They will not mention exactly the same word. And see, here you have POSM. That's in the question. Was developed by, developed. Then only able to communicate using a bell. Limited communication options. These are the things. Only, limited is the synonym. Okay. Name is there. All these are the. Yes. Anyhow, I am not going in detail. I'll show you the next question in the same paragraph we are taking up. Maybe 10th question is about the same paragraph. That's the beauty of it. This is from official material. And I will give you the details in the next question. That's why I'm not taking up this question in detail. Okay. Now let's go to the 10th question, next question. You'll see the beauty. Yeah. According to the writer, why were early portable AACs problematic for those in wheelchairs? What are the hedging words?
Portable ACs, problematic.
Yeah, portable AACs or AACs, anything. Once you are competent, you don't require anything. Just you need to only for AAC. AAC. Okay.
Problematic.
Once you are competent. Until then, you can take portable also will help you. The adjectives definitely help you. Why also you can, because their reason. They're asking for a reason.
Why?
This is, this is same paragraph. Now, if there is a name in the question term, what is the rule?
Go directly to the name.
Go directly to the name.
Yeah, before that, there is one instrument which is disturbing continuously. That means if you can find that person, just put them out, no problem. Because I've been telling them from the very beginning, it's not attending. Such people, please don't come to Zoom classroom, okay? You are disturbing everyone in the world. If you don't know, if you are a newcomer, you please mute. Don't unmute your video at all. Don't interact. From the very beginning, I am being disturbed. That's why we don't admit you. Okay. Option A, they were heavy and bulky.
Heavy and
Bulky.
Okay. I'm not able to highlight. if you have the hard copy, you have taken the hard copy, you can highlight, okay? Heavy and bulky. Mine is not responding. My laptop is aged, getting retired. Okay, they were remarkably fragile.
Remarkably fragile.
Fragile.
Well, fragile or remarkably fragile?
Remarkably.
Once you are competent, fragile is enough. One says heavy and bulky, one says fragile. Then they could not be used while walking.
While walking.
While walking.
Could not be
Could
used.
not be used.
They needed access to a power source.
Power source.
Needed access to power.
Access.
Access to power
Needed
source.
access.
Whatever. Yeah, I cannot
Access.
highlight. So you can highlight, okay? Yes. Now, if there is a name, immediately you have to go to the name. Now you'll have to remove that person and come back. See, that will take time. I can't help it because from the very beginning, somebody is cooking and all those sounds. Admins, can't you hear those sounds from the Zoom classroom?
Yes, Father, I kept her in the waiting room.
Send again. Is that Yusuf?
Yes, Father. Fatima Yusuf.
Yeah, just put in the waiting room. From the very beginning, I'm requesting, please mute, please mute. Write down those names, okay? Because there must be some spammers purposely coming here to disturb the sessions, okay? Cool. Yeah, smile. My system is not responding. Yeah. Now it's clean. And it's just take note of those names, okay? Some people come, spammers come, disturbed.
Okay.
Sometimes we feel sympathy and we admit them. And we see them waiting in the waiting room. Person is cooking there, we can make out from the sounds. Not even listening to the class, otherwise our repeated requests will be heard, right? Now I can't highlight, my system is not responding. So if you have a name, you have to go to the name. Where is the name?
Last second part.
Yeah. Let me check if my system works. Disabled people is also speaks has many other meaning further, but still the concept is related to voice.
9th line is.
One sec. Disabled people is also speaks has many, speaking about the previous one, right? It's okay. We'll come back if need be. I'm trying to highlight, but my thing is not working. Sorry. Yeah. One more minute. Let me try to connect it. Yeah, no, it will be cool, I believe. Am I visible and audible?
Voice is audible, sir.
Okay.
The screen is visible in the YouTube.
Okay. All right. Now here we are, right?
Yes, Father.
Yes, sir.
Wait for 2 seconds to reach the YouTube. Visible. Thank you. Thank you. Thank you. Thank you. So heavy and bulky could not be used while walking. Could not be used means useless. Okay, that's great. Now you know you have to see there is some disturbance. Can you make out who it is? Please don't unmute when you are not interacting. Or if you have any background disturbance, please don't unmute. Many you can send out anyone who has muted their video, okay, and doing some other work. Okay. So AAC, immediately when there is a name or abbreviation so equivalent to name, you have to immediately go to the AAC. Where is the AAC? AAC is given here.
9th.
Yeah. Which means with that principle, you can ignore whatever comes before it. Okay. So earlier answer was in the previous segment, right? Same paragraph.
Yes, sir.
Once you know this strategy, if POSM, you have gone to the first portion, then you came to AAC. Now they are saying in the 1970s, the first portable, commercial, available, adaptive alternative communication devices, AACs were produced. Although they were advertised as portable, these devices often weighed a hefty 15 to 20 pounds and tended to range from 20 to 25 inches in size.
Option A, Father.
Yes,
Heavy
sir.
and bulky.
Heavy and
Yes,
bulky,
Father.
right?
Yes, sir.
Synonyms or synonymous expression. How simple, within fraction of seconds, you can reach to the answer. Ranjini, you wanted to say something?
Yeah, Father. A and B is the quite opposite. Father.
One sec, coming.
The comparison between A and B, Father. B
they
is
were
fragile and
remarkably
A is heavy and
fragile.
bulky. So
Fragile means
yeah.
not strong.
Yeah, Father, it's
Not
an
light.
opposite.
No, they are not quite opposites, right? Bulky means bulky. Heavy and bulky means it speaks about the weight. But fragile means It's not strong, right?
Okay, Father.
Maybe you can conclude a meaning like that, but that's not the straight opposites.
Okay,
Okay?
Father.
Bulky, heavy and bulky means, and opposite is like, for example, you cannot say she is fragile. She is weak, you can say. See, if somebody asks you what is the difference between thin and slim? Thin and slim. Thin. Can I say Ranjani is thin?
No, Father, it's slim.
Not because she is slim. Okay? She is slim because thin is used only for neuter gender, inanimate things. A line is thin. A stick can be thin. But a human being is slim, S-L-I-M. Animate thing, human being. So this is not opposite of it. Fragile is not opposite of heavy and bulky. Don't worry, that much competency is not
Okay,
required. If you want to take it as opposite also, there is no issue. One of them will be right, one of them is right, definitely. But then we are not going into it. Just I wanted to highlight this particular thing which I am posting. I already posted 6 examples, most of them from official OET materials in the episodes. And every text you will find at least 2 with this strategy. Name, which means within fraction of seconds you can answer and go. Now only because of our technical issues here we had some delay. Otherwise, within no time you get it, right?
Okay, Father.
Okay.
Yes, Father.
Yeah. Now let's take it a little further, if my system allows me. Okay. So how beautiful. See? See, strategy is applicable. Now we dealt with only one strategy. Even in the previous one, you can apply 6 or 7 strategies. Now I am going to tell you what are the strategies applicable in this particular question answer. We have taken only one strategy. What was the strategy? Name or abbreviation.
Name step.
Name or abbreviation or name. Same it is, okay? But then other strategies, that is AACC is the abbreviation. Other strategies I'll show you. Numbers or measurements were mentioned, right? In the 1970s, 15 to 20 pounds, 20 to 25 inches in size. Do you see those things in the answer?
Yes, no text it's given.
In the text it is given, right?
Yes, Father.
Yes.
Number and measurements. When I said there are so many strategies which can be used. That's why I said, take this very seriously. Sometimes the videos are about the same material, but strategies are entirely different. Okay, maybe I have taken this particular text earlier, but this explanation is entirely different. Sometimes maybe in the episodes I have mentioned only the name strategy, but there are so many other strategies applicable. When I said when you find a name or abbreviation, you have to highlight it. When you find numbers or measurements, you have to highlight it. When you find adjectives, you have to highlight it. What are the adjectives here? Weighed, hefty. Okay, scale, often. If you have hard copy, underline all these things. Okay, synonym used, bulky, size, heavy, hefty. The question and answer option and text. Contrast used,
Also.
portable.
Also.
Opposite is heavy and bulky. Portable means you can simply take it. Mobile phone. Heavy and bulky means land phone. You can't carry it. So, conjunction in the answer option. They were heavy and bulky. Usually, if there is a conjunction, more possibility leans towards that answer. Then, complex sentence. What's the criteria about complex sentence? Answer will be
There is.
in the independent clause.
Dependent.
Independent clause, not dependent clause, main clause. How do you understand which is the independent clause?
Comma before, after
Yeah.
comma.
Before comma.
Yeah. Independent, if there is a dependent clause first, you will find a comma after the dependent clause.
Dependent
So
clause.
whatever comes next after the comma is independent clause or main clause. So answer will be in the main clause. Now again, there are other strategies I am not mentioning. Even topic sentence gives this answer. I think Indrajit, do you have some the background distractions?
No, no, father. I'm
Then
sitting
who
in my
else?
bedroom, sir. I'm alone here.
Someone else is having too many. Don't you hear others?
I'm not doing anything, father.
No,
I'm just concentrating on class.
Yes,
no,
yes.
just
I heard, father. I heard the voice behind this.
lot of sounds. It disturbs, a whole lot of people, thousands of people who watch this on YouTube. So don't do that. And such people, if you are identified, you will never be admitted again, whatever your situation, because we are telling you not to unmute if you have disturbances in the room. You are sitting in a place where you are disturbing, or you are cooking and listening, then you can definitely listen from the YouTube, right? That's why you connect it. Okay. So even topic sentence is another strategy where you have paragraph structure as a strategy, but I have not taken it up. What I'm saying, I have shown you 8 strategies now to identify the answers. Say number or measurement. Okay. Contrast. Portable says heavy and bulky is the answer. They were advertised as portable, though they were advised for these devices often weighed hefty, although they were advised. Contrast, you see, people said it was advertisement was saying it is portable, but it was very heavy. So contrast is there. Heavy and bulky is the contrast. Portable, heavy and bulky. Then you have complex sentence. See here, although this is a complex sentence. When there is a complex sentence, one of the name, the answer will be no in the main clause. No, you can, others can interact. Okay, don't worry. There's only people, those who, maybe some beginners, you can interact, don't worry. I can understand. Okay. Yes. Then synonym, bulky, size, hefty, heavy. Yeah. Hefty
Heavy.
is here. Heavy, bulky. Yes. See how many size, bulky. See portable, contrast. According to the writer, why were early portable ASCs? I can't read it. What is that? First, I can't read it because.
Portable, these devices often weighed a hefty
No, sorry.
15.
I wanted somebody else to read it, but nobody want to interact now. We will stop the session probably.
I'll read further. From where I should read?
No,
From
it's okay,
portable.
it's okay. No need. Okay, we'll go back. Since you are not interested, we will not deal much on that. We'll go into. This was requested by Nitya Bin, admin, yesterday. Asked me to give some ideas about reading part A, since we are dealing in the discussion reading part A. Please attend the discussion. Those are the best useful ways of understanding the things. And whenever you have some doubts, admins will clarify. Otherwise, they will ask me to take sessions on particular things. This was yesterday's topic. I see. Reading, reading means you have part A, part B, and part C. Okay. So part A has 4 texts. I'm not going to explain those things. Text A, text B, text C, and text D. Now the instructions are this: time 15 minutes, and you'll be able to do it within 7 minutes, definitely. If not 7 minutes, maximum 10 minutes. Okay. Sorry, where am I? Am I visible in the YouTube?
Yes, father.
Yes, yes.
Okay. Right. Look at the 4 texts A, B, C, D in the separate text booklet. You'll be given a separate text booklet, and the question answer will be different booklet. That will be collected soon after 15 minutes. So our target is to complete it in 10 minutes, if not in 7 or 8 minutes. For each question 1 to 20, look through the text A, B, C, D to find the relevant information. Okay, write your answers on the spaces provided in the question paper. Some people do write answers in different places. So make sure you just fill in the space given for the answer. Answer all the questions within the 15-minute time limit, which means those answer sheets of part A will be collected. So after 15 minutes, you will not be able to do anything later. Your answers should be correctly spelled. Spelling mistakes will be penalized. And good number of you lose your score because you make mistakes in the spellings. You are not allowed to make even minor mistakes in the spellings. Okay, reading part A. Four texts, text A, text B, text C, and text D, but one theme. Okay, all the 4 texts will have one theme, whereas in the part B, all the 6 texts will have 6 different themes. And reading part C, text 1 will have same theme, text 2 will have a different theme. 20 questions, 15 minutes time. Greatest challenge or enemy is time. Expeditious, fast reading task. What do you mean by expeditious, fast reading task? Means your speed. Smart reading is not your detailed reading. Your smart reading is tested here. You have to read very fast. Unless I say the expected brand score is
450
450, if not 500. Okay. Yes. And if you target below that, what happens? If you need A, you need to get 18 out of 20. If you can just calculate, well, then A. But then you have to score at least 20 out of 19 or 20 out of 20. That's the best way to score higher. Greatest mistake, targeting grade B. This is the reason. You target grade B, the psychological impact on mind and brain, you get 340, 330, 320, 310. Because your mind will be satisfied by getting 30 right. You say, okay, I am competent, I can write. Then you will never improve. And I tell you, this is the biggest hurdle people face. That's why always I tell you to target grade A or more, A or A plus. And greatest mistake is targeting grade B. Whatever you practice, however you practice, you end up with 340 or 330 or 320. Okay. Okay, part A, nature, expeditious reading task, 20 questions, 15 minutes, almost like 45 seconds for a question. Skills assessed here. Number 1, your ability to skim and scan quickly across different texts on a given topic. Specifically, your skill to skim the text. Okay, most of the questions will be answered by skimming the text. Ability to locate specific information from 4 short texts in a quick and efficient manner. Okay, ability to understand the conventions of different medical text types. There are different conventions. I've already explained different conventions or how texts appear and what are the sequence, all those things. And again, we'll be explaining. And also they assess your ability to understand the presentation of numerical and textual information, number and text together. Okay. Yes, today we'll be just looking into yesterday's discussion. This was asked by admins. Necrotizing fasciitis. Am I pronouncing it correct? I don't know. The first step is identify 4 text headings and write down on a piece of paper. Do you have a notebook? And if you have the hard copy, take the hard copy and notebook. Or on the hard copy, if you have the hard copy, you can write on top of it. Identify the 4 text headings. I'm not going to explain in detail, okay? Now, what are the 4 text headings? Can somebody tell me? Then second step is understand the relationship and sequence among the 4 text headings. So now there is text A, text B, text C, text D. Can somebody tell me what are the headings?
Text A is a description classification. Text B is a treatment. Text C is a supportive care.
Okay.
4 is an advice on aftercare.
Okay. Just write down these things, text A, definition or description, whatever you want to ask. These are just for your convenience, for your understanding. Anything you can write, okay? Definition and classification. Text B, treatment. Text C, what was that? Support care, right?
Supportive care.
Supportive care and
Supportive care.
care.
Okay, supportive care. Text D, advice on
Advice
aftercare.
on aftercare.
Yeah. These are the 4 texts, one theme. Okay? About NF. So this is the one. Text A, definition and classification. Text B, even instead of definition, if you write description, also no issue, okay? Because we are not bothered about the scientific difference between definition and description, only for your understanding. You have to write this on each table, each page of your question booklet. Text and question booklet. Treatment, supportive care, advice on aftercare. Okay. Now, step 3, skim the 4 texts, highlight the clues. Skimming the 4 texts means you will have to do it within 5 seconds. Okay. You can do it within 5 seconds once you are competent. Now you can take a little more, like 20 minutes, probably 20 seconds. Now, what you have to skim for or look for while skimming? Title of the text, section heading. If there are section headings, subheadings. Okay. Section headings. Title means, for a, what was the NF is the title. Then each section, each text may have a heading, that is section heading. Then each text may have, for example, definition and classification. Subheadings probably will be there in some texts. Then you have to look for names. Names of what? Names of any test, any medicine, any medication, any instrument, any device, any names. Then number and percentage. Then look for sequential expressions. Look for frequency expressions. Sequential expression means first, second, third, another one. Okay, lastly.
Yeah.
Then frequency expressions, very often, rarely, seldom. Okay. Then scale. You know that. All, majority, most, majority, many, some, few, all those things. Adjectives. If there are beginners, don't worry, we'll have separate segments on all of these things. And also, there are so many videos uploaded, nearly 368 videos of reading is uploaded, sessions are uploaded. All these things are separately in each segment, it is explained with examples. Adjectives, these are then negative expressions. These are the things you have to look for when skimming. Skimming means just running through the text. Now, can you find out something here? Any of these things? Let's skim one text. Okay. This is what? Necrotizing fasciitis. Am I pronouncing it correct?
This one.
Fasciitis.
Yeah.
This one.
Fasciitis.
Fasciitis. Okay. Why 2I? I don't understand. Okay. Fasciitis. Because it's not pronounced as it is written. So text A, this is what I said, 4 texts will be there. What is this? NF, the first one what I highlighted is?
Necrotizing
That is heading.
facial.
That is the main heading. And all the 4 texts will be dealing with this topic, this heading. And now here there is no subheading, but then you can find, if there is no heading, subheading, you can find out here. What is this?
From the topic sentence.
From the topic sentence, necrotizing fasciitis is means they are going to describe or define it. Describe or define it. If you know, if you have attended my sessions, you know definition has 5 parts. Definition has 5 parts. Name, verb, the class, the connective word, then the features or characteristics or symptoms. 5 things. So here, necrotizing fasciitis is this one is the name. Name mentioned here, NF, till NF. This one is the
Subject.
but verb.
Verb.
Okay. Then as severe rare, potential, lethal, soft tissue infection. That is the class to which it belongs. Infections, different infections, right? And NF is one of those infections. It develops in the scrotum and perineum, the abdominal wall, or the other extremities. These are the other characteristics or symptoms or places where it develops. So you have these 5 parts in a definition. 1, 2, 3. That, okay, here this word should be, there is a spelling mistake. This should be that, okay? That develops. So this is, that is connective word. So name, verb, the class to which it belongs, infection, okay? NF is one of the infections. That is the connective word. Develops in the, that is the rest of the thing, the characteristics or where it develops or what are those things. So 5 parts. So there is a definition. So what do you highlight here? The topic sentence gives you the idea. It's a definition. Then what else you have to identify? Have you written down this?
Percentage.
Just write down these things. And just giving you the other screen. These clues just write on your notes fast. Title, section heading, subheadings, names, numbers or percentage, sequential expression, frequency, expression, scale, adjectives, negative expressions. So you have to identify these things in while skimming the text. Send a smile, some emojis. Did you complete? Done?
Yes, Father.
Okay.
Yes, Father.
Okay. We'll go to the next. Now the definition portion I will not highlight here. Okay. So since if there is no heading, you have to look for the topic sentence. You get the heading. So this is the definition. Then what else you can identify here? Whatever you have written now.
Septic shock.
Septic.
What is that?
Third line.
Condition.
Okay. Septic shock is a condition, right?
Yes.
I don't know. You are the health professionals. I am not. Okay. Septic shock. Then
Mortality rate is high.
Mortality rate is high.
okay.
Scale expression high.
It's a scale.
32. 32 plus
Then
32.
32% I said you have to highlight the 32 number or percentage. So here you have number and percentage. Yeah. So you have to highlight that. Then next one is
Classification.
you don't have,
Classification.
yeah, you don't have heading here, side heading, but then it is written classification of response pathogens according to type of infection. So classification is the subheading. So for the heading, you can create a heading as text heading, text A, definition and classification, only for your understanding. Okay. Now here you see you have to understand this classification of responsible pathogens according to type of infection. Okay. One type of infection, one type of pathogen, or 2 types of pathogens. Each type. So you have to connect that relationship. Now, microbiological pathogens, site of infection, comorbidities, type.
Types.
So type 1, type 2, type 3, classification. So here, just have an idea what are these are pathogens. This is a site of infection, where it will be, where the infection will happen, which part of the body. Which part of the body. So as soon as a part of the body is asked in the question, answer will be in this column, right? You have to connect that part of the body with the type of infection. So you can maybe highlight here. What are the pathogens? I don't understand this much because of medical terms. You know, site of infection, you know, these are the trunk and the peripheral limbs, trunk and perineum. Limbs, trunk and perineum, only 2, 3. It's all repeated, but 2, 3 body parts are given. Diabetes mellitus, comorbidities type. A trauma, seafood consumption, then immunosuppression. Okay, let's go to the question. Then see. I'm just skipping the steps. Hope you, if you have taken the hard copy, you have this, right? Do you have this? We have taken
Yes,
the print.
Father.
Take this
Yes.
page. That's why I type this page together, all the questions, for you to understand. Now, you have to highlight the hedging words which connects to one of these categories. You are supposed to mention only 1 to 7 questions, match the text, right? But then I suggest while you practice, you match the text with all the 20 questions. That's a very good practice. Then immediately you know where is the answer, in which text. You search all the text. So these are the 4 things you should have in your mind: description, classification, treatment, supportive care, advice on aftercare. Now question 1, the drug treatment required. Which
B.
one?
Treatment.
B.
Drug treatment.
What is the hedging word?
Treatment.
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 Yeah, treatment. Immediately what,
Treatment,
where, you
sorry.
know where it is, right?
B.
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 Next.
Yeah. So B. Yeah. Which parts of the body can be affected? Parts of the body.
A.
A.
The description.
Classification.
A. Description.
Okay, let's write. We are not confirming it, but we'll write all those things. The various ways calories can be introduced. Calories.
C. Supportive care.
Supportive care.
Okay. Or aftercare.
Supportive
Yeah,
care.
let's see.
Supportive care.
Let's see. Yeah. See, we'll confirm later. Yes. Then who to contact to help the patient after they leave the hospital? After they leave the hospital.
D.
Advise
D.
after care. D.
D.
Advice on aftercare.
D, right?
D. Yes.
Yeah, sorry, I made a mistake here. This should have been. That was automatic numbering. 1 sec, I'll change it. This should have been A, right? Oh, sorry. Yes, 1 sec. Otherwise, it will confuse you. Yes. Now this is right. After they leave the hospital, aftercare. So easily you can connect it, right? What kind of dressing is to use?
Kind of dressing.
Kind of dressing.
Dressing.
Supportive care.
Figure C.
Yeah.
C.
Dressing is supportive care. C. Yeah. And you are getting 10 marks each, right? So within fraction of seconds, just reading without looking at the text at all. Then how long to give drug therapy to the patient? Drug therapy.
Treatment.
Therapy is the synonym of,
T.
Treatment.
yeah, drug and therapy both are the synonym of
Treatment.
treatment. Yeah. So B. How can they give such easy questions in OET? Yeah. They're asking you to match the text. Go and read the text and match where, tell us where this information is given. But already things are said here. Next one. What advice to give the patient regarding needle use? Advice.
Advice.
D.
D.
After
D.
D.
Aftercare.
Yeah.
Advise on
yes.
aftercare.
Yeah. And you say this is difficult, right? Yeah, which two drugs?
Two drugs.
Drugs
Treatment.
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 B, Father. B.
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 Till 7, well, this is what you have to do, nothing else, right? 70
Yes,
marks within fraction of seconds. Just read, type the letter. Yes. What we will do for 20. Which common metabolic condition may occur with NF?
Metabolic condition.
A.
Metabolic condition.
Description. A.
Condition, the class, where it comes?
Description A.
A, Father. Description and
Yeah. Yes. Then, what complication
A.
can a patient suffer from if NF isn't treated quickly enough?
A. Description.
A.
Okay. Then, 11th question. What procedure can you use with a wound if the patient can't be operated on? Procedure.
Supportive care.
Supportive care.
C.
C.
If patient cannot be operated on. What is it? Is it supportive care?
C.
Support C.
C.
C. Father.
Okay. What should the patient be told to use? Patient be told. Synonymous of?
Advice.
Synonym of advice.
Advice.
So,
D.
Clean to
D. And that's why I said you should know the sequence, you know. The patient be told to use to clean an injection site. That is the advice on aftercare, right? So
Yes,
the patient be told. Which two drugs again?
Treatment.
Treatment. B.
Treatment.
B.
How simple and easy. Treatment. B, right? Yeah. Yeah. 14th one. What kind of infection should you use tetracycline
Treatment.
for?
treatment.
What kind of infection
Wow.
should you use for tetracycline?
Yes, Father.
Treatment, right?
Yes, Father.
Yes, Father.
B.
B. My system is slow. 15. The average proportion of patients who die as a result of contracting NF is proportion.
Description.
Average proportion.
Percentage.
A. Father.
A, Father.
A. Father.
Yes. Yeah.
Patient who have eaten dash.
16. Patients who have eaten dash may be infected with Aeromonas hypofluid.
A.
A.
A, Father.
Yeah. There should be some food item, right? Mentioned, right? In the gap. Answer should be eaten something food. Yeah, some food. Yeah. Then type 2. Patients with type 2 infection usually presents with. See, as soon as you see type 2, you know what is it, right?
A.
A.
Classification, right? Classification. Again, here also you need not even read the full thing. Type 1.
A.
Okay. You need not even read the sentence question. Immediately you know where it is. A. You have to just go and search that type 1, type 2. 19. The patient needs to be aware of the need to keep glycated hemoglobin levels lower than dash.
D.
D. Aware.
Advice.
Aware of
Yeah.
Advice.
They needs to be aware.
Need to be aware.
Needs to be aware. Patient needs to be aware means advice to patient.
Advice.
Yeah, advise him. Create awareness in him. That is aftercare. So,
D.
yes, D. Last one, 20th. The patient will need a course of dash to regain fitness levels after returning home. After returning home.
Aftercare.
Aftercare, right? So this is the advantage of having the headings created first. Now immediately, you know, this is while practicing. Okay, when you do your exams, nothing is required. Once you are competent, as soon as you read, immediately you identify the things. Okay? You can simply go to that site. Now you know exactly where the answers are. As simple as that. Then when you highlight, I have skipped some portions to make it sweet and short. Now if you come back to, now let's see. You will be doing, okay? I'll be just sitting here. You have to tell me what is to be done. One can take up the chance to do this, yeah. I'll be doing whatever you say. Now, skim this text. I will highlight whatever you say.
Antibiotic treatment.
Okay, treatment, right? That is a subheading.
Yes.
Treatment is the word we used for our heading, short heading, just to understand. So the whole thing speaks about treatment of type 1, treatment of type 2, treatment of 30, treatment of type 4. So what will you highlight here immediately as you go on? Medicine names.
Ampicillin. Ampicillin.
Medicine.
Salbutamol.
Okay. There will be many because it is treatment. There will be many.
We
You
need
can
to
highlight them.
type 1,
Yeah.
2 first.
Yeah.
Type
We
1
need
is
to
a
underline the type 1, 2, 3, and 4 first.
Okay. Yeah. Okay.
yeah.
Type 1. Type 2. Type 3. Type 4. Maybe I think one more step I will do with the first text, so it will be easier for you. Let me check. One more step. Okay. Now you see we have highlighted those words here. Okay. See here. The questions were. Give me one sec. I'll just copy and paste. So that when you go to second thing, it will be easier for you. If you are not finding competency in your practice, you can definitely do this, okay? What I'm showing you now. Copy, paste, paste. Yes. Now you see questions. From a text, you have 1, 2, 3, 4, 5, 6, 7 questions. You can write down this way. Once you have written A, B, C, D there, you know, from each text, right? You can collect those texts together. Now you have written here A, B, C, D. Right? All the A's should be together, question numbers. Copy and paste there or write down. Then B's together, C's together. That's what I have done here. You know, questions 2, 9, 10, 15, 16, 17, 18 are from A text. Next step could be this one. Okay. Which parts of the body can be affected? Where is it? In the definition, right?
Yes.
Oh, sorry. In the definition, which part of the body can be affected? They're asking you to connect it to the text. See? Infection levels in the all these parts, right? Scrotum, perineum, abdominal wall, the extremities. So this is number 2 answer for number 2, question 2. Then 9.1, which common metabolic condition may occur with NF? Where do you have 9th?
Diabetes mellitus.
Where do you have the answer? It is here with the type, right? Comorbidity is type along with diabetes mellitus. This should be 9. Okay, there is a mistake. This should be 9, right?
Yes, sir.
That's good.
This is 9 and this is 10. Typing mistake. I'm just showing you the headings. We will not be doing everything here. Later you can do. 10. Okay. Yes. Then next question, 10 you have already here. 10, right? What complication can be patients suffer from if NF isn't treated quickly enough? That is mentioned here. Infection progresses rapidly and septic shock may ensue if it is not treated immediately. Hence, the mortality rate is high. Okay. Then the average proportion of patients who die as a result of contacting NF is average proportion. When you say proportion, you know, it's speaking about
Percentage.
number, right?
Number.
Mortality 32.2%. Then 16. Patients who have eaten dash may be infected with Aeromonas hydrophilia. So they are asking for a food item, eaten dash. Who have eaten?
Seafood.
Yeah,
Seafood.
seafood. Seafood. Okay, then you have here 17 patients with type 2 infection usually present with infected dash. So immediately you have to go to type 2, right?
Yes, sir.
Type 2, limbs.
Parts of body.
Infected limbs, parts of the body. Then last one, type 1 NF is also known as, immediately you have to go to type 1.
Polymicrobial.
Yes, type 1, polymicrobial. Yes, it's given in the bracket. Also known as, bracket means also known. This means this, right?
Yes,
So that is it. Now we'll go to the second one. I just wanted to give you an idea about it. Yes. So these are the answers. So which part of the OA is given in the diabetes mellitus. Then complication, septic shock. Then proportion of results, patients who die, 32.2%. Seafood may be infected, eaten seafood. Type 2, infection usually present with infected limbs. Type 1 NF is also known as polymicrobial. That's it. So let's go to text 2. Now you can continue, okay? It's your cup of tea. Where is text 2? B. Yes. Text B. Okay, we are doing this. Yeah. What else you want to highlight? Fast. Medicine names you'll have to highlight. Antibiotics such as
Ampicillin.
Ampicillin.
All the antibiotics, tetracycline.
Yeah. You can highlight these things and connect it with the type when it appears in the question. Then type 2.
MRS.
MRS.
MSSA.
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 MRSA.
Next MRS.
MRSA.
MRSA.
or daptom.
Vancomycin and daptomycin.
Okay.
Listeners.
Always whenever there is a conjunction, possibility is there, okay?
Yes, sir.
And is here, right?
Yes, sir.
Normally there is a possibility if there is a conjunction. Okay. Type 3.
Clindamycin and penicillin.
Clindamycin and
Yeah.
penicillin.
Again, there is a
Medicine.
conjunction.
Yes, sir.
Possibility.
Conjunction.
I don't know. Possibility. Because conjunctions are very sweet for OET and IELTS people. Then if
Vibrio infection.
Vibrio infection condition is
Tetracycline.
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 Doxycycline and minor.
This is also medicine, right?
Yes, sir.
Cephalosporin.
Okay. I can't read some of the terms. Since these antibiotics have been shown to reduce the mortality rate, statistically. Type 4.
Amphotericin B.
Amphotericin B.
Again, there is a conjunction, right?
Yes, Father. Or is there?
Or
Possibility. All may not be the answer, but one or two of these three must be the answer, I believe. Okay, all need not be. But the
Fine.
results of this treatment are generally disappointing. And this is a technique they use, okay? But there's a
Contrast.
contrast, right?
conduct.
If there is a contrast, what happens? This can be treated with this, but it is not useful. Sorry, this one should not be okay. Sorry, here. I should not come here. So this mostly they use very often in the IELTS tests, in listening tests. Now they are saying can be treated with these two medicines, but the results of this treatment are generally disappointing. No results at all. Do you need to treat?
No, negative expression.
So what happens? This normally, I don't know, will not be the answer. Because already said these are the medicines, but that will not have any result. You will never be healed, which means don't do it.
Yes,
Correct.
sir. Yes, Father.
So immediately you can eliminate such negative expressions. That's what I said. You should be able to understand negative. Antibiotics should be administered for up to
5 days.
for up to 5. Number is there, right?
Yes, Father.
5 days.
5 days.
Number is very important. Okay.
And 4
Medicine name and number.
4 to 6 weeks.
4 to 6 weeks.
Antibiotic therapy.
Yeah, 4 to 6 weeks. These numbers are very important. Now we have names and numbers in this thumb 2. Now let's go to the questions. B. Sorry. B questions. Give me 1 sec. Where are we? Where are we? Yes, B. Yes, here. Paste. Do you have stamina or tired?
Yes, Father.
Yes,
Yes,
Father.
See, these are the questions. The drug treatment required. So we said it is heading is
Treatment.
treatment. We'll just highlight once again. How long to give drug therapy? How long? Drug therapy is treatment, right?
Yes, Father.
Therapy is treatment of synonym. Now they are asking how long. Means there should be number, right?
Yes, Father.
How long? How many days or something like that, right? Which two drugs can you use to treat? Which two drugs means two drug names will be the answer. Two names that we highlighted will be the used to treat Clostridium. Yeah, treat this particular pathogen. Okay, so you have to link between these two, this condition and these drugs. Which two drugs again? They are asking again the names of two drugs. How simple once you understand this. To treat what? Can be used if you can't use. Yeah, if you can't use. Yeah, if you can't use this one, which two means? So you have to look for this name. With that, it will be given, right?
Yes, sir.
Yeah.
Yes.
What kind of infection should you use?
Tetracycline.
The tetracycline medicine for which infection? They are asking what kind of infection, which type of infection? Which type of infection? You have to simply connect it. So, where is it? Okay. So, where do you have the answers? First one. The drug treatment required. Already you know, it's in B, right?
Yes, sir.
Yes.
The drug treatment is the C, concept of B. How long to give drug therapy to the patient? It is in B, only to connect. How long to give drug therapy? It is given at the last lines, right?
4 to 6 weeks.
Oh, see, I said 5 days, 4 to 6 weeks. Numbers are important. That is next question. And next question, which two drugs can you use to treat Clostridium species of pathogen? Clostridium. Where is Clostridium?
Is it type 3 for the clindamycin and
Type 3.
penicillin?
Clindamycin and penicillin.
Clostridium. We did not highlight this. This we should have highlighted, right? Okay. So the answer is?
Clindamycin and penicillin.
Yeah, I said when there is a conjunction, that there must be the answer, right? And that is right. So again, sorry. Oh, confusing. See, which two? We are 13. Which two drugs can be used if you can't use vancomycin? Vancomycin. So look for vancomycin.
Type 2.
There is vancomycin. See vancomycin.
Type
We have
2.
highlighted here.
Daptomycin and linezolid.
Linezolid.
Again, I said if there is a conjunction, that should be the answer, right?
Yeah.
See, so many medicine names are given, but where there is conjunction, that is the right answer. But here there was or another conjunction, but that was negative expression, so we eliminated it. How beautiful. Next, 14th one. What kind of infection should you use tetracyclines for? Tetracyclines. You have to look for tetracyclines. What kind of infection? Tetracyclines.
Type 3 in Vibrio infection.
Yeah, tetracyclines we have already highlighted. So what type?
Vibrio infection.
Vibrio infection. So what should be the answer? Vibrio or infection?
Vibrio.
infection.
Yeah.
Vibrio.
Yeah.
Vibrio
You can write Vibrio or Vibrio infection. Both will be right. But if you write only infection, that will be wrong. You can write Vibrio or Vibrio infection. Both are right because this is not filling the gap.
So the short answer.
This is short answer. It's not filling the what kind of infection they're asking. So you can say Vibrio infection or you can just say infection. But if they're asking dash infection, should you use Tetracyl for? Then you cannot write Vibrio infection. You have to write only Vibrio. Because otherwise they'll be doubling. You will lose the mark. Did you understand? There are some doubts repeatedly asked. Should we write Vibrio infection or Vibrio? Now don't confuse. If it is a fill in the blanks, if you write Vibrio infection, that will be wrong. Because dash infection, after dash infection is already given in the question, then you cannot write infection in the answer. Only Vibrio you have to write. Do you get me?
Yes.
Yes, Father.
Yes, Father.
Okay. That is so beautiful, right? Simple and beautiful. Name and numbers. So the answers are here. C, B, B, then syntramycin and penicillin, Vibrio infection. Even if you don't write and, that is right, okay. Even if you put a comma there or if you write 2 words there without and, that will be right because which 2 drugs they are asking. Just write 2 drugs name or you can write with and, conjunction. But the clue is there, whenever there is a conjunction, mostly that has maximum chance of being the right answer. Okay. So, shall I give you one more task?
Father.
Yeah. Now skim this.
Supportive care.
What has to be highlighted?
Supportive care.
Supportive care. That's what we have taken as the heading, right? Since there was no heading. Yes.
Next, wound care also.
Hmm.
Wound care, second paragraph.
Wound care. Okay. What else?
Where it's mentioned nasogastric tube, pectube.
Where?
This can be delivered orally via nasogastric tube.
Which line?
Fourth line.
Here.
Fourth
Okay.
line.
Fourth line.
Okay.
24 hours.
Should
24 hours.
24 hours.
Hospitalization.
Okay.
Adequate nutritional support, second line.
Good. Okay. Yes.
Next, albumin. These are the names we need to highlight.
Where is
Baseline
it?
and repeated. Last baseline and
Baseline.
Monitoring of albumin.
albumin. The names
Pre-albumin.
pre-albumin. Just only the names you need to write.
Baseline repeat monitoring.
Triglycerides.
Okay. I'm coming to next para.
One more thing, we need to increase the caloric intake. Require increase the third line. Increased required increased caloric intake.
Okay.
Bone care. Vacuum assisted closure, VAC.
VAC.
Wet to dry dressing.
Dry
First line,
dressing.
the topic sentence, wet to dry dressing.
Second line.
Second line, advanced wound dressing have replaced wet to dry dressing. Grafting, fourth line, grafting.
Skin graft.
Okay, let's go to the questions. Just copy the questions one sec. This is C, right?
Yes, Father.
Did you find the C had very little strategies compared to A and B?
Yes, Father.
So you'll have very few questions. Only 3 questions, I believe. Let me just paste it. And you see, the various ways calories can be introduced, that is in C. What kind of dressing to use, that is in C. What procedure can you use with a wound? Because 3 and 5, we have simply answered it, right? Just reading it.
Yes,
We don't require, because
Yes,
synonyms expressions were there. Now we are bothered about only about 11. What procedure
11.
can you use with a wound if the patient can't be operated on?
What?
That's all you have to see from. That's why you don't see so many strategies here or clues here. If we cannot be operated on, what procedure has to be used? Where do they speak about?
Vacuum assisted
Vacuum
closure.
assisted closure.
VAC.
Vacuum assisted closure, Father.
Okay. Vacuum closure was recently reported to patient who cardiac arrest
Long
see
surgery.
the patient soon in local management. Do they say about cannot be operated upon?
Yes, Father. Means there is a cardiac status was 2.
Where is it mentioned? The question says when a patient cannot be operated upon.
A patient
Yes,
with cardiac
there is a
status.
patient's condition given. Cardiac status was too precarious to undergo a long surgical
Okay, under long surgical. Okay, correct.
Also,
Yeah, too precarious to undergo a surgical restriction operation. Okay, correct. Exactly, you're right. So it is VAC, and you know there is a name that definitely is the answer. Abbreviation, right?
yes, sir.
Yeah, that's the only name you have here. So that is the answer. How simple. Once you know there are only 3 questions from this and 2 are answered, you need not spend too much time on that. Maybe you can leave it for the last minute. You can skip such questions. So that's why I said when you see there's no many answers. So immediately you can go A, B, D, then come to C. Did you understand?
Yes, Father.
Okay, now text
Yes,
D.
Father.
Tell me what is to be highlighted.
Advice.
Advice and
Advice
aftercare
to
was
the
the
patient.
heading given. Okay, advice to give the patient before discharge.
Then remind.
Okay,
Remind.
remind. Okay,
The wedding.
yeah.
Diabetic patient.
Before discharge means after care. Patient while discharging means after care.
Yes.
Anything you can write, whatever you to for your understanding. Okay, now just skim it. Aftercare is given here in the beginning itself.
Home health care and
Management.
instruction regarding board management, social services to
Tell me what I have to
Wound
highlight.
management.
Wound
Wound
management. Okay.
management.
board management,
Social
lifestyle
services.
changes and
Lifestyle changes and
financial
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 concerns.
concerns. Physical therapy.
Okay, fast.
Physical therapy.
Physical therapy.
Optimal physical
optimal
health.
physical health,
Physical health.
promote the return to optimal physical health. Yeah.
Life threat.
Life-threatening nature.
Certain nature.
Nature of NF.
Limb amputation.
Scaring.
Limb
Amputation.
amputation.
Limb amputation.
Caring limb amputation.
Limb amputation.
Remind the diabetic patient to.
Then next last HbA.
You have percent.
HbA1c,
Then HbA1c.
7,000.
A1C you have. So if there is number name, that will be the answer. Then
Not to
Needle
reuse
capped.
Needle.
Not
Needle
Not
capped
reuse
until
the needles.
use.
Do not.
sorry. There
Not
is
reuse
some
needles.
mistake. Let me clear it. Needles capped until use and not to reuse needles.
Needles.
Needles. Okay, needles. We'll just highlight needles, then you can come to, if there is needles, you can come to that.
Clean the
Alcohol
skin thoroughly.
clean the skin.
Glucose testing or insulin
glucose.
injection.
What is that?
Clean the
testing.
skin thoroughly.
Insulin injection.
Alcohol pad.
Alcohol pad.
Alcohol pad.
Use alcohol pads. Okay.
Yes.
Okay. Let's go to the question. Question is here. Let me copy it one sec. C. C.
Where we need a D.
D, father.
D, right? D, right?
D, father.
Sorry. D, okay. D. D, yes. Right. Okay. Okay. So these are the questions. Who to contact to help the patient after they leave hospital. After they leave hospital, we said that is aftercare. Who to contact to help the patient. That is just to mention the
D.
D letter, nothing special. 7 also. What advice? That is, we already seen D.
Regarding.
So we do not worry. We have to worry from here. What should the patient be told to use to clean an injection site? Clean an injection site. What to be used?
Alcohol pads.
Alcohol pads.
Where is it? Did we highlight? Yeah.
Last
And use alcohol pads to clean
Alcohol
the
pads too.
area afterwards. Yeah.
Afterwards.
Alcohol pads. Okay. Then next question, that is 19th one. The patient needs to be aware of the need to keep glycated hemoglobin levels lower than. Lower than means number. Hemoglobin number. You have to look for number.
7%.
7%.
And you,
7%.
you know from your knowledge as well, right? Hemoglobin
7%.
HbA1c or less, lower than 7% or less. Answer is here, 7%, right? 7% is the answer. Okay. Yes. So beautiful. Then last question. The patient will need a course of dash to regain fitness levels after returning home. Course of some medication, right?
Therapies.
Patient will need a
Course of something.
Physical
Therapy.
Physical therapy.
Physical therapy.
Physical therapy to rebuild. Yeah, it is given here.
Physical
To
therapy
rebuild.
session to help rebuild strength.
Yeah.
And
Yes. To rebuild. You see, to help rebuild strength.
Strength and promote the return to the optimal physical health.
Yeah, yeah.
Yeah.
Same. So that is clear. As simple and direct. In reading part A, you don't have any direct answers, right? They are asking you to copy the answer, giving you the text and copy. Even the primary school students have to do it, right? They are telling you, this is the text, ma. This is the question. You copy from this text and write here. Correct? That's what you do for the exam if you are given the chance to keep your notes and write the answers. How simple they are. Yeah. And if you say this is difficult, what should I say? How do you say this is
Thank you,
difficult?
Father. Thank you so much, Father.
No, I just wanted to know. How do you say this is difficult?
Today I
Did you-
didn't say difficult, Father.
No, did you find any answer which was confusing?
No, Father.
No,
Direct
Father.
answers, right?
No.
Direct answers. See, you have to write down this way, okay? The questions and all that together. Write down. Even writing down is cool in the beginning stage. You'll really understand. It will help. See, this I did not do this task, but you can try this also. Categorizing stem words and phrases from questions, keywords from the text. This too long. I did not do it. Let's try doing this once. Just write these four headings and make 4 columns in a page in your notebook. Fast. 4 columns: definition, classification, treatment, supportive care, aftercare. 4 columns in a page. Just let's try. Hope at the YouTube you are enjoying. Let me check the YouTube.
Excuse me, Father.
Yes, please.
Father, I have a night duty, so
Yeah,
now I will.
please. Carry on. Carry on.
Okay, Father. Thank you, Father. Thank you very much, Father.
You are most welcome. Yes. Try writing down. Did you write the 4 columns?
Yes,
Once you have done, say yes in the YouTube comment space. Say yes.
Yes, Father.
Thank you for those who have purchased the superstars. Okay, superstars. There's an option given for helping our ebook. You can buy superstars there. Yes. That's how those whose name are seen with a crown, you see, they have purchased a superstar. That's why, to support the platform. Yes. Thank you all. Sini Abraham. Yeah, Sini Abraham is right. Sini Abraham, then who else? Yeah. I'll see later. Okay, definition. Now you have to fill in the blanks. I am just calling out the name. You have to shout which column, okay? Treatment. Say second column, third column, fourth column. First, second, third, fourth.
Second column. Treatment.
Okay. Parts of the body.
A. Description.
Okay.
A, sir. A.
Calories. Supportive care.
Calories.
Supportive care.
Supportive care. After they leave hospital.
Aftercare.
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 See, A, B, C, D. These are 4 questions, okay? From 4 questions, A, B, C, D. 1, 2, 3, 4 questions. Just answer A, B, C, D. Okay, kind of dressing.
Wound care. C.
C. Supportive
Aftercare.
care.
Supportive care. Okay, drug therapy.
B.
B. Treatment.
Advice to patient.
D.
Aftercare.
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 Okay, 2 drugs to treat.
Treatment. B.
Metabolism
Treatment.
condition. Metabolic condition.
A.
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 Complication.
A.
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 Procedure if the patient can't be operated upon.
Aftercare.
Supportive.
No. C. Supportive care.
C.
Supportive care. Okay,
Supportive.
patient be told. Advice.
D.
Aftercare.
D.
Drugs.
B.
Treatment.
B.
B.
Kind of infection.
A.
Average portion of who
A.
die.
A.
A. May be infected.
A.
A.
Type 2.
A.
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 Type 1.
A.
A.
Patient needs to be aware of. Advice.
D.
Awareness.
D.
D.
D. After returning home.
D.
Care.
See, these
D.
Aftercare.
These are the heading words I selected from this, which we highlighted. So this is an exercise which you can try. So immediately you can locate. Prepare this just to show you. These things will help you. Okay. Actually, I had prepared all these PPTs, but I wanted you to work it out so that I can understand whether I can manage. All these were already done by me. Okay. Any clarification on this?
Thank you.
Thank you
Okay.
so much, Father.
You are most welcome.
Thank you so much.
You are most
Thank
welcome.
you so much, Father. Thank you.
Yes, if anybody has now regarding other things, if you want to, yeah, I'll be discussing on other resources and all. Some questions which are sent to me, I'll just take my phone, and others can just come in here in the YouTube live. If you want this, I will be stopping the YouTube live. These informations will be given in the Zoom classroom here. I am just sharing the link. Okay. Yeah, those who have some emergency can leave, but those who have asked me questions can remain about the resources, ebook, and all those things. I am posting the Zoom link in the YouTube comment space. You can join here. We will be closing the YouTube and we will be having these details at the Zoom classroom here. Can you see I am pasting from Edu Skills the Zoom classroom link. Those who are at YouTube, if you want to have the details, you can come here. I have collected all the questions being asked to me in connection with the session. I promise them I will be answering here. We'll go from below. IELTS or OET, which one is easier to understand? Both are easiest for when I look at them. Now, this is a very crucial issue. There are people who jump from OET to IELTS. It's never advisable. Especially health professionals, definitely you should go for OET because it's going to help your life. This is the knowledge you require. These are the information that you require to practice in other countries, European countries. Do you understand? So always my suggestion is health professionals OET. Because comparatively, if you ask me which is easier, if you ask me which is easy to understand or interesting, I say both are really interesting. Fabulous. Because once I start OET, I get addicted to OET, then I find difficult to go to IELTS. Now I started IELTS, now I find difficult to come back to OET because IELTS is so interesting, so sweet. Okay. Now, for health professionals, it's always OET for reasons. Reason one is you need this information, this knowledge. For example, letter writing. Otherwise, you have to learn it when you go to the other country. And these informations are all on medical topics, whereas IELTS can have any topics under the sun about environment, technology, and all other things. So you can admit everybody, okay, Mini?
Yes, Father,
Okay.
but Fatima Yusuf was disturbing.
Okay. Yeah. Now it's okay. Now disturbance, okay, no problem. Yes. Okay. Then, so health professionals always OET, I suggest. Don't skip to IELTS. I have seen many people who have said, sorry, father, I have stopped OET. Now I am learning IELTS. I get a lot of messages. That's not a correct decision. Okay. Good evening, father. Next OET batch, when are you going to start? I wanted to study OET. Please help me. Next OET batch, you can attend live sessions. If you are really active, we will have batch. Okay. But then now you can start with episodes 1 to 30 already posted. Small videos, 3 minutes, 4 minutes, 5 minutes, below 10 minutes. When you watch the video, just write at least 2 sentences in the comment. What did you understand? At least the strategy. Did you understand the strategy? What type of question it is? Write at least 1 or 2 sentences in the comment box so that I know whether you are following the track. I can easily assess most of the comments I read. Not all the comments I read. So it's an easy way for me to give you customized sessions. Okay. Next one. Yeah. And materials already Minnie Jackson has explained. You can go to the title of the Telegram, OET Telegram group. Click on the title, go to the file segment. Okay. Then if you want writing, you write writing. Okay. Reading. You can search all the files, all the authentic materials are available there. Then if you want for listening, you can find the audio in music. And same date, you see the date is available there. Same date, go to the files if you want the script and question. Just go to the same date. Is that clear? Okay.
Father, I want to ask something.
Yeah, please.
Father, actually, I'm getting through the writing. I am watching your video, so just a little difficult for me to find the relevant case notes.
Okay. Even case
Yeah.
notes you file in the file segment, you will find all the case notes. Just type
I am
there in the
trying,
search bar,
Father,
you
and
write, you just type writing. You will find all the writing case notes there. Nothing else, no? Regarding writing, only case notes.
okay. I will try again, Father. I was trying, but I couldn't find it. Yeah.
Now, what you can do is, for example, the selfishness is so hard. Now, you see, in this platform, thousands of people are studying. You all have material. Before you ask, give them the material and say, I have these materials, please have it. If you have some, please share. Let everybody share in the main platform. I can share, but I have to search and share for everybody, right? Whenever they ask repeatedly, I have to share. Now let everybody share each other, whatever the materials you have. Maybe you have some material, Varsha has some other material, Jyoti will have some other material, Indrajit will have some other material. Let everybody share. And if it is not authentic, something wrong, admins will draw my attention or they will inform you not to use that. Okay. And try to, due to copyright issues, see that you don't share something with the copyright. Okay. For which you can even copy and paste and share. Because you know already our active batch is banned now. Okay. That is barred by a Telegram. So there are a lot of risks. It's not easy to manage the platform. There's a tech team behind this platform. Okay. Otherwise, you can you just ask in the platform, they will share. Okay. Let everybody share whatever the materials you have. Even otherwise, I'll give you the details of other things. Okay. Because I have a lot of things, but I have to, every time each person asking, I'll have to search the hard drive and share it. It takes a lot of time. Then I'll not have time to take sessions. Yeah.
I got it. Thank you, Father. I got it. I'm searching now. I got it. Thank you so much.
Okay.
Yeah. I was struggling a lot
welcome.
how to do it.
Yeah. Now what you have to do when somebody else asks this question, you have to answer them. Okay. That's how we help each other and grow together.
Yes, Father, I will. Thank you.
Yes.
Yeah.
You know what is the difficulty? Yeah.
And Father, I did not understand how to do with the Grammarly. Actually, I was trying to copy and paste through the screenshot. Actually, I couldn't do it.
No, you just copy and paste in that box, in the document box.
Do I need to write the wording myself in the notepad and then copy?
No. Anything you can copy and paste or type, anything you can do there. You can copy and paste from any document. For example, you have written a letter. Just copy and paste in the Grammarly. they will show you the mistakes. But
Like,
don't correct
Father,
the.
you know, I was doing like the video you are showing, like on the YouTube. I'm just getting the screenshot. The screenshot I want to just copy into the Grammarly, but I couldn't do that the same way. I think I need to write it first myself.
Do you have a letter? Just send me and in my Telegram. I'll show you now.
I don't have any letters, Father. Actually, I did
Anybody
not
has
write.
any letter or a document? You can just send me with some mistakes. That means, do you find any letters submitted by anyone?
No, Father.
No, sir. Till now, no.
Let me check. Any documents, if you have, you can just send me and notify me. I'll just show them. Now you see here, you see a document, right?
Father,
Oh,
I
you can't
sent.
see. One second, you can't see, right? Did you send something?
Yes, Father. In Telegram, I sent letter.
One check. Telegram. Who sent it?
Damrati.
Okay, but that is case note, right? No,
Yes, Father.
no, I want something document which I can copy. It's okay. I'll make some mistakes here. Can you see the screen now?
Yes,
Can you
Yes,
see
Father.
my
Father.
screen?
Yes,
Okay,
Father.
let me create
Yes,
some
Father.
mistakes. There are no mistakes in this text. I am creating some mistakes, okay, just to show you. See, when there is a mistake, red line will be shown. Don't worry about the other gray lines. Okay. Now
Okay,
you see
Father.
you see the screen, right?
Yes, Father.
Yes,
Yeah.
Father.
Okay. Now you see this document, 91% clarity is there, correctness is there. Yes, okay. Right?
Yes, Father.
Okay. Now you see I created some mistake here. Red underline means mistake. Okay.
Yes.
So what you have to do, if you click here, that will be corrected, but don't click. Just go there and click on that word.
Okay.
When you click on that word, now my net is slow. When you click on that word, explanation will come here. Let me check on a new. One check, I'll copy one para and go to a new document. New document. If you are a beginner, if you have not done anything, immediately you will see a new document box here as you open. You can see I have done so many things. See, now you can paste here. I have copied that first paragraph. Paste here. See, now the writing quality is 83%. Grammar and clarity is missing 7%. Now an attempted. My net is low. Otherwise, when you click here, the explanation will come here. What is the mistake? This side. You can read that or write down that mistake. What is the explanation? Now net is low. Otherwise, if you want to correct, see, I am clicking on this and attempted and is removed. Then there is no red line. Now the God, the is not correct. The explanation here will say, you need not use definitive article here. Then click God is corrected. That's all. See here, the history, not required, corrected. Relation, relations it should be. That is corrected. And a comma before and, that is, we call it Oxford comma, even with or without that is correct. Now you see 86 has become 92. Now, again comma. Now one more mistake somewhere and here. Come on. So you see, all those grammar mistakes are clear. Now clarity problem is 5%. Now 96%. I have reached 94 from 86. Okay. Yeah, that's only paid version. All those minor details. Did you understand that?
Yeah, Father, but my question is that I can't copy and paste into the Grammarly. This is the problem coming.
Maybe network
Correction
issue.
is okay.
Maybe network issue. Otherwise, definitely you can copy and paste. Now I have shown you, right? I copied it from the
Father.
document and pasted it. Anybody can copy. Maybe network issue.
Okay,
You can try
Father, I will
again.
try later.
Yeah.
Thank you, Father. Thank you so much.
Welcome. Any other doubt? Yes. And
Father, do we
yeah,
have a more video for the speaking?
yeah, plenty of videos are there. Now I have already posted for reading. I have already posted and listening practice materials. 23 of them are being posted every day in the main platform. And those who require what you call material.
Sir, all that, Father, all that 23 video we can't play. Some are written is there,
maybe
like we can't play the video.
2-3 because our own people who come here, students, will help us by reporting us. So some are deleted by the YouTube.
Yeah, it is deleted. Yeah, Father. I'm
There's
trying one to 23, but
some
can't
people
open
show
it.
the gratitude once they pass. They show us the gratitude by reporting our channel. So we have to take that reward. So maybe 3 or 4 of them. It's okay. We'll delete those admins. You can just delete them if you know which are the once you click, if you know which of them are deleted. Otherwise, I will remove and give you.
Okay.
And you have reading. You have nearly 370 sessions uploaded. I have made recently playlist. One, you can scan that QR code. It is being posted every day in the main platform, or the link is given one link. If you click that one link, you can find all these 370
Readings.
uploaded videos. Everything about OET is there. Nowhere else in the world you will find so much explanation. All those are not just videos, they are the previous Zoom sessions. We never create videos. No marketing videos. Okay. And writing also there are. Listening, reading, so many videos are there. We will make the playlist. Otherwise, you go to EduSkills OET and you just type in there. EduSkills YouTube channel, no? Write EduSkills OET, then you type in there writing, reading, or listening. You will find all those videos. And we are also compiling them together. We will make the playlist. I am correcting it. And we'll send you in one link where you can access all the videos of writing, listening, reading, and speaking. Okay. We'll end the YouTube. Anybody wants to come here, you can come. Okay. Today I'm giving you a little more time because I'll not be able to join again soon, maybe. There are not enough people to learn, that's why. See, I am posting one more time, the link there. If you want to join, click on that link. We are closing YouTube Live. We'll go 5 more minutes in, and then I'll be reading the concerns and answering some of them there to read. Yeah. All those set to YouTube, otherwise bye to you. Okay. If you want, you can join here in the Zoom classroom, clicking on that link, which is posted 3 times, 4 times in the YouTube comment space. Come in. Yes. We'll be closing YouTube. Okay. And screen. Yes.